Welcome to Politics NY with Skye Behind the Curtain, where we speak with community advocates about their specialty and what's going on with them. So right now I'm with Sheila Thorne. She is the founder of the Multicultural-Healthcare Marketing Group. And we're going to learn a little bit about her and have a conversation about healthcare and health policy, which is top of mind for so many people right now, and even more so since the COVID-19 public health pandemic. So welcome to the show, Sheila.
Hello, Skye. Thank you for having me. It's a pleasure to be here and to speak with you again about a very important topic that's near and dear to my heart.
Yeah, so tell everyone a little bit about your organization and how you got into that role.
My company is called Multicultural-Healthcare Marketing Group. It's a long name, but it is actually what we do. We focus on the healthcare issues of people of African, Hispanic, Latino, Asian, and Native American descent. We're a small shop. We're all of color. Half of us are multilingual, and we've been home based since 2003. So the pandemic has not slowed us down. And we work with pharmaceutical companies, hospital systems, health plans, any entity that really wants to do a better job about reaching out and connecting with people of color in terms of health information, treatment options, new products and new devices. So we help our clients engage, reach out to and sustain engagement with these communities. And we also work on a professional level. We work with physicians, nurses, oral health professionals, mental health professionals, physician assistants, nurses, whoever has patient face time in the community, and give them an idea of how better to connect with these communities and respect and celebrate culture.
So what are some of these practices that you're working on now and that are part of the conversation?
Yeah, I think people are well aware that the declaration of COVID-19 on March 10th in 2020 catapulted globally everyone in the mode of how do we contain this horrific pandemic and get people treated. Unfortunately, once that pandemic hit the United States, it clearly was glaringly illuminated that the injustices and inequities in healthcare among communities of color are pervasive and persistent. They're here. Even if you have insurance, even if you have income, these populations, Black, Latino, Asian, Native American, were infected more, getting sick more, hospitalized more, and dying faster. So that particular phenomenon thrust us into a very different dynamic of conversation about how do we keep these populations healthy, certainly here in the United States, but it has implications globally. So I think the very first trend, Skye, that I saw back in 2019 was the fact that these populations suffered from comorbid conditions, underlying conditions, lack of access to quality care, lack of access to medical information and devices. Once that began to really bubble up, people, organizations, healthcare professionals started talking about, why is this the case? It's not just about money. There's a lot of other stuff going on. So that led us into the conversation of social determinants. And that's a phrase that has really been currently in vogue in these arenas about healthcare. And simply what that is where you live, work, play, and pray. What is that environment like? Okay. And if you don't have adequate transportation, you don't have enough nutritional food, you clearly aren't educated enough so that you understand health, those dynamics become more drivers of health outcomes than having an insurance card or having enough money. So the conversations, the trend I'm seeing is, how do we put social care into medical care? How do we make sure that not only do I get an appointment with a doctor, but I have the transportation to get to the appointment? Now, clearly, this is not necessarily the responsibility of every company, but it clearly has to be considered when you're writing health policy or you're trying to get these populations to be healthier. That's a very important trend.
Right. And that's where government leaders could enter the conversation. And now more than ever, are they paying attention to these public health facets of community and social life?
You're absolutely right, Skye. And I think clearly that's the tipping point that we're at now. Our legislators looking at whether those kinds of organizations who deal with food, transportation, housing, and education, are they putting enough resources in those entities and organizations that can help a patient lessen the burden of their disease and get the quality care they need. That's a very different conversation than I've heard in past years. That's a much more important conversation because it's systemic. It's how do you fix the system that undergirds healthcare? Huge opportunity now that we see where the gaps are. We see where the disparities are. And there's a saying that we use in healthcare, and you probably have heard this. It's a better predictor of your health outcomes is your zip code, not your genetic code. Okay, so it's where you live. So those kinds of policies that legislators put in place have to have that as part of the equation.
Right. So it takes these companies to really lobby on behalf of their community to get these things up in order in these communities.
Yeah. And even more importantly, who do you bring into the room when you need information about what kind of legislation? It's not the usual suspects. It's some different people who are out in the community trying to help these populations live a quality life and see what the resources are that they have. So that's certainly number one. The number two trend that I see, which I've been actively involved in for the last 20 years, is cultural competency education, diversity education. It's not going to be possible that everyone of color will have a physician of color. There just aren't enough numbers. So if you're going to have a physician who is not of your race or ethnicity, does that affect the quality of your care? People are finding out that it does make a difference. And clearly that's an opportunity for the healthcare professionals to be educated about diversity. So my company spends a great deal of time educating providers, healthcare professionals about how to understand culture, communication style, family dynamics, life and death experiences. And we've been doing this for a very long time before it became popular. I was doing this with physicians and nurses around the country. That now has definitely increased exponentially. And how do you become culturally competent? What even does that mean? So I just did a 4-hour session with a major research foundation on this very subject. And these were PhDs, these were MDs, these were MBAs and MPHs, highly educated people, clearly committed to healthcare, but have a cultural deficit. So my company, Multicultural Healthcare Marketing Group, we spend a lot of time helping organizations embrace, understand culture beyond just language. They'll translate a brochure in Spanish in a heartbeat, okay?
Right.
That's the easy part. How do you understand culture? That's the second major trend that is really barreling across the country with respects to licensure. It's not just a nice thing to do, you gotta do it.
Right. And then even tying that back into government and politics, since that's where my brain goes, that what we're seeing now, the more we elect diverse leaders to represent the community, the better equipped they will be to serve these diverse cultures and populations.
Precisely. You've got to reflect the population that you're serving or reaching out to. If you don't, you're going to miss some things that may be critically important to assist those populations. And I think that's the kind of conversation that's been having now, where we step in and give an assessment. You know, where are you on the cultural competence continuum? How much do you know about the cultures of the people you live and work around? And once you get that assessment, then you can design a program so that you can do a better job with people of African, Hispanic, Latino, Asian, and Native American descent. You don't have to know about all those cultures, but you certainly have to know about the ones that walk in your hospital, walk in your practice, or walk in your door. Those are the ones that you may want to focus on to begin this multicultural journey, because it is a journey.
Yeah, multicultural journey, seeking equity at the end of the day. It comes down to healthcare equity and everything equity.
Yes, you've hit it right on the nose. That is the buzzword and the term that's being bandied about. It's not equality, it's equity. It means that I have the same opportunity to achieve my optimal health that you do. And that then levels the playing field. So you then, legislator, have to give me the tools to enable me to achieve health equity. That's the key here, because once you have equity, then hopefully we all can begin to do a better job of eating better and exercising and all of that. But if my community is not safe, hard for me to exercise. If I don't have a large supermarket in my neighborhood and I have to depend on small mom and pop shops or bodegas, and those are great, but they may not have the variety of food that I need to be healthy. So
Mhm.
how does that happen with legislators and districting and business and zoning and all that kind of stuff? So all of that kicks in so that I have equity. Do I have to take a bus to go way downtown to a hospital, or is there one around the corner?
Mhm.
And so clearly those are the dynamics that legislators have to, the big picture, what does it take for me to be healthy?
Right, the big picture. And you mentioned the social determinants of health in the beginning of the conversation. And that's something I learned when I was getting my master's in public health about 10
Uh-huh.
years ago. And I remember on our webinar, it's something that you said, it's no secret. This has been the thread here. The theme is that there isn't healthcare equity. The signs and symptoms are there, but
Right.
now it's just like an extra kick in the butt to really fix it since the pandemic.
You got that right. I mean, we definitely now have no more excuses. We have to be more accountable. We have to be more intentional and focused on these issues. If we're put in the position of serving constituents and we see the constituents are not as healthy as they need to be, that affects communities, that affects families. If I'm not healthy, I can't work. And if I can't work, that's going to affect my income and certainly affect my family's livelihood. So it's all connected. And I think people get overwhelmed, Skye, because they see that this is complex.
Right.
This is not simple, and I get that. But I think if we, in each of our respective areas of expertise, can take on one piece of that puzzle, it'll help for everybody. So legislators have a huge agenda, and they have a lot to address in their communities: safety, education, all of those things. Health has got to be figured in the top priority, because if it's not there, then you have nobody. You have no staff, you have no workforce, you have nothing. So
Mhm.
health has got to be a priority. And these groups, unfortunately, are sicker than most other groups for a lot of historical reasons, as well as current situations. So policy is the linchpin, it's the key.
Mhm.
And we always think about insurance coverage, which is absolutely critical, but that's just one piece of why disparities exist: poverty and lack of insurance or insufficient insurance. There's a whole lot of other stuff that's going on that definitely keeps us in this disparities mode.
Right. Not only is it complex, but the subject matter itself is pretty intimidating
It
especially when you
is.
start talking about healthcare and health insurance. Like there aren't a lot of people out there who understand exactly how the system works.
That's exactly right. I was just on a Zoom meeting earlier today with a group of pastors in Black churches, and they all were interested in finding out how they can better inform their congregations about health issues and
Mhm.
where they need to go to get help and services and resources. So again, it's a conversation that's being had in a number of very different arenas that all play a part in fixing it. The healthcare system is complex. You can't fix it overnight. It clearly has suffered under being, I guess I might say, underfunded, under-recognized, and unfortunately, that's part of the problem. But I do think there's a lot that can be done even without money. And I tell you, one of the things that I do is I go into communities with my team and we talk to healthcare professionals. Usually it's about a certain disease: diabetes, HIV, cancer, prostate, breast, lung, colorectal, whatever it might be. And I ask them, how much do you know about this condition? And I get varying answers. And then if you do get the condition, where do you go first? So we do a lot of needs assessments
Mhm.
before we put our programs in place, because we want to go in and hit right where the needs are and not go in and do things that just have no relevance. So we spend a lot of time doing what I call community mapping. And we go into these communities, we talk to different healthcare professionals and other people, and we come away saying, okay, if we want to do a program on type 2 diabetes, these are the groups and the people we need to work with. These are the trusted voices. These are the media outlets that will help us to get the message out. So what I do and what my team does, I call evidence-based marketing.
Mhm.
We don't just go in and just distribute materials. We go in and we address exactly what we have learned the community needs. And we build from there and get partners. You cannot do this without partnerships. I don't live in every city in this country. I may have visited most of them, but I look at the community. I say, I don't live here. You help me. What do I
Right.
need to do to get the message out about breast cancer or prostate cancer or HIV? And just recently, as you know, we lost one of the major figures in the federal government, General Colin Powell, to multiple myeloma. I don't think many people even knew what that condition was.
Mhm.
I just finished doing a project with the Multiple Myeloma Research Foundation. It's higher in men of color over 75. And if you read the news, he was 84.
Right.
Is it preventable? Is it treatable? Well, I won't give you that information because that's a longer conversation. But just the recognition, even a few months ago when Chadwick Boseman, who was in the Black Panthers, he died of colon cancer.
Mhm.
There was a rush to people going to the hospital to get colonoscopies. So again, I think people kind of know this there, but if they get it, or a family member, a loved one, they don't know what to do, Skye. So
Mhm.
we help our clients understand whom they should be talking to, what the message is, and how they have to get the message out. And that's evidence-based marketing. That's really going where the fish are biting, really meeting people where they are. And that to me is what's been the key to our success.
Right. It's the ground up, not the top down. And that's another
Absolutely.
thing. That's what people are looking for. They're looking for transparency. They're looking for easy answers, easy access to information as the
That's
world
right.
is becoming digitized, especially, people look
Yes,
up anything on the internet, but it's really bottom up.
exactly. And it's certainly a simultaneous bottom up and top down. So I want to talk to all the professionals who you may have to go to be treated, but I always want to educate the patient about what you're going to get treated for and why. And what's your prognosis? What are the opportunities? And you used a very important word. You've got to be transparent with the community because there's a deep level of mistrust and distrust. And
Mhm.
if you hold things back or you misinform, they'll never come back. So you've
Mhm.
got to be genuine, authentic, and transparent. I want to know the good, the bad, and the ugly. Okay, then I can deal with it. But if you hold it back, then that makes it difficult for me to really become in charge of my own health. So those are not qualities that come easily to healthcare professionals because they're used to just telling people what to do.
Mhm.
Okay, they're not used to being questioned. And
Right.
sometimes our legislators fall into that bucket too. They can't know everything. So you need experts, you need trusted voices to kind of be at the table to help you craft this legislation that once you put it in place, it's hard to get it overturned. So
Mhm.
you want to make sure you get all the facts before you make a decision and reach out and ask the community their opinion. It's a process, it's a journey. And again, I've seen successes on a number of fronts, but we need to do more. We need to do more.
Right. So the types of clients you're working with, I know are everyone from global businesses, hospitals, you mentioned all these types of businesses. Are there any specific examples that you want to provide to people who are watching?
Well, I think one of the key factors to the delivery of quality care is clinical research. And I've been working on a number of programs, how we can increase diversity in clinical trials. We heard a lot about this with the COVID-19 vaccine development and the fact that not many people of color wanted to volunteer for those trials because of history, abuses, because of personal experiences. So I think the example that I would give most recently is working with a group on how do we get more people of color into a cancer trial. And that's daunting. It's going to take more resources. It's going to take some different players, and you need a different skill sets in how you write the clinical information, the research documents, and how you get people involved. And again, there has not been, in my experience, enough transparency in that process. It's just sign them up and get them in, but then you don't really tell them what to expect. So the recent examples that I've been working on are trying to engage organizations, clinical researchers, of how better to communicate the importance of volunteering for a clinical trial. What are the safeguards that have put in place? Once those abuses happen, the government kicked in quickly and put safeguards in place. Now, is there a guarantee that it will never happen again? No, but there are now more safeguards than ever before, that if you volunteer for a clinical trial, you always have the option to drop out. Nobody forces you, but you have to be educated. And so I enjoy doing that part of it because from that, you go to healthcare delivery. If you've got the right data and you understand how this drug works in me, then I'm better equipped to take charge of my health. But if you're guessing, because all of this research is on white middle-aged men, not even women, Skye, okay?
Right.
Certainly not women of color. If you have only that kind of data, you may be in trouble, and it could be dangerous that you kind of use that information and apply to me as a Black woman. Maybe it doesn't work. So I enjoy those kinds of conversations, and my team and I work very hard to educate clinical researchers on what they really need to be aware of when they're designing these clinical trials. Working with government and working with pharmaceutical companies. But again, the key to success, partnerships. You've got to walk in the door with someone whom the community trusts. And that finding that person may not be as difficult as you think. If you talk to enough people, I usually ask them, if I'm going to come in this community and do a program on cancer, who needs to walk in with me? I said, give me 5 names.
Right.
And as I go to each person, the same names keep coming up. And they're not usually doctors. They're not usually anyone of any great celebrity status. It's just common community folk. You need to talk to this one. Maybe it's the woman who owns the Botanicas, the place where the Latino community goes for herbs and all kinds of things. Maybe it's somebody else that is a community health worker.
Right.
So again, we go in to try and again put together a group of trusted voices, faces of people who look like that population, speak their language, and come from where they come from. They are my experts. I give them the information. They tell me how best to communicate it.
Yeah, it's like a campaign. Again, I don't mean to tie it to politics, but it really does have a lot in common.
It does. Yeah. Yeah, it does. When you're looking at and in fact, that's one of the people I always talk to. I talk to elected officials when I go into the community. They're community outreach people. And you probably have been in that position. And I say, okay, I want to do a program. Which are the groups I need to connect with? Right. They know where all the bodies are buried, so they help me to find the right people, and they help steer me away from those who may not be as positive about this effort as you might want them to be. So they're always on my list, elected officials, appointed officials, because they deal in the community. They know the folks that we need to tap into.
Yeah, it's really valuable information. Sheila Thorne, thank you from the Multicultural Healthcare Marketing Group for being part of this conversation. And I will post your website link underneath this video on our site so people can check out more of your work and learn more, because it's really an integral part of the conversation.
No question about it. We feel we are community, and we're happy to help people understand and share with them what we've learned, because we are continuing on our journey. So thank you, Skye, very much for this opportunity.
Yes, thank you for coming.